Welcome to our next episode of Integrative Connections, a wellness podcast for people and pets. And today joining us is Chelsea Britton, a registered dietitian nutritionist based out of Placerville, California. And she has a virtual practice, coaching practice with regard to nutrition and wellness. So thanks for being here, Chelsea.
Thank you for having me.
Yeah. So tell me a little bit about your background and how you evolved to the place that you're at professionally.
Yeah, I have always been interested in health, and my mom was very intentional in raising us, to eat your vegetables and to move your body every day. And so that was inspiring, but I actually never had heard of a registered dietitian, even though my mom was a nurse and in the medical field, until I was in college already, and I was pursuing a culinary arts certificate and a business degree, thinking I wanted to open a restaurant because I love food. I love to eat. I love the flavors. I love how it, all the sensory parts of food and herbs. And so I realized, I don't think the restaurant life is for me once I learned about the preventative approaches that being in the wellness arena can provide for patients. So I changed everything in college from avoiding the hard lab science classes. I had taken geology and anthropology, and I needed to fully do a 180 to jump into, anatomy, physiology, biology, organic chemistry, all those classes. And then, the internship, and was able to start off working clinically inpatient at a local hospital. And after that, it also didn't feel this isn't the best time for patients they're not hungry to learn, they're hungry to leave the hospital. Sure. And, talking to a patient about a heart healthy diet right after they had surgery when they're barely eating, it's just not a great time for intervention for me to try to connect with these patients. So then I was lucky to start working alongside a local functional physician, and I got to work in his office, Dr. Barley. He's phenomenal.
Is that here in
Placerville?
In Placerville?
Mm-hmm. And so I was very lucky to work with him and learned a bunch from him, but just also was able to apply a lot of these medical nutrition therapy modalities and interventions live with motivated patients, and then we could measure their outcomes for years to come. So that was like the start of my functional training and approaches, was just to be right in there in the doctor's office. And then I connected later to a couple other area clinics, and along the whole ride was building a private practice also. And so I had at one point 4 contracts that I was working with different clinics and helping their patients, and then building my own practice. And now I'm fully on my own, and I'm so grateful for the experience I had with each clinic. Every clinic operates very differently, and different providers, order different tests or utilize different modalities. So I'm very grateful for that. But it is, I'm all on my own in private practice now.
That's great.
Yeah.
That's great. So what's kind of the scope? Can you describe to me the scope of your services, mm-hmm. what you can, with your licensing and degree, offer to your patients? Mm-hmm. And then do you then go and collaborate with other practitioners for other things that are out of your scope?
Yes. So I'll tell you what I cannot do first. So I cannot order lab testing, meaning like, let me put in the order and go get this, go to the lab and get your blood drawn. I also cannot write prescriptions. That is, that's way out of my scope of practice, even though
diagnosing, treating.
Basically. Yes. Right. And so nutritional diagnosis, that's one thing.
Okay.
So I can make nutritional diagnoses like, inadequate intake, or suspect, there's a lot of like kind of gray diagnoses, like suspect intestinal permeability, right? If I don't have any stool tests to back it up. But there are other clinical diagnoses that I work with that patients might already have that we are working on, like acne or eczema or migraine or even mood symptoms. But I am not the primary provider who's managing those symptoms. We're looking at a preventative lens on what are we doing in a lifestyle setting that might be a trigger or a promoter of that other chronic condition.
Sure.
So I'm not making formal diagnoses. That is correct.
Sure.
But because I have worked alongside other physicians, I might be suggesting to clients other workup, especially through their insurance-based provider. So many clients that I see feel kind of like they don't understand the Western medicine, or they're confused with their insurance-based model, or where do I go, or I got a dead end. And I really love to bridge that gap where I can encourage them to ask for those metabolic labs from your insurance-based provider that you're already paying for.
Sure.
And so that's something I'm very comfortable advocating for and with my patients, is even just basic metabolic and nutrient labs.
Even with regard to working along with their GP,
yes,
they don't necessarily have to be working with a functional medicine specialist.
Exactly,
okay.
Exactly.
That's really great.
And I'm not talking about really deep down, like homocysteine or like even C-reactive protein. Some physicians would kind of roll their eyes at my my requests, or my patients saying, hey, my dietitian said, let's do this. I get that. But I probably, over the years of recommending and asking physicians, it's close to 80 to 90% now when I'm asking for pretty basic, we're talking about like metabolic labs, like, hemoglobin A1C, fasting blood sugar, sometimes fasting insulin.
A lot of them will do the fasting insulin now?
Sometimes now. That one's not at the 80, 90% yet. It's more like 25%, but it's starting to pick up a little bit.
That's cool.
Yes, cool. It's taking time, but then like vitamin D isn't on a lot of physicians' radar. So I'm just reminding them. So basic. And I'm not being too aggressive either with, every 3 months or anything, even just every 1 or 2 years. Right. Or if it's been low before, we should probably recheck it.
Right.
So vitamin D, B12, and then sometimes iron panels warranted, ferritin can give a really good idea also with the microbiome, what else is going on there.
Okay. So you do a lot of looking at vitamin levels and basic metabolic tests, basically, or what you're gathering information.
Yes.
Which are pretty wide stream and,
They are. And it's not...
mainstream.
Yes. And also it is using the insurance-based model.
Yeah.
Because there is this whole other avenue of functional lab kits that are in my scope of practice. Okay. So for example, I prefer to do home collection kits for a variety of reasons, but there's a food allergy and sensitivity test.
And these are things that people can just order on their own.
People can just order on their own online, but if they order it with my guidance, I help interpret the information for them. So that's one example, and that's a test. Like it's a Q-tip. You kind of do a finger stick and collect some blood and can gather a lot of data on food allergies and sensitivities. And then I also interpret stool test using a home kit. Also, it's just it's convenient for these functional lab tests to be able to collect it at home and then mail it off.
Well, it seems like that's kind of the direction that a lot of the functional medicine testing is going anyway, is to put the power in the hands of the patients. And a lot of them are available directly to the patients now. Yeah,
and a lot of that I think is based on insurance. So these functional tests, this second conversation of the functional tests that I do offer versus the lab testing from your provider or your insurance is just that. They're functional tests. So they aren't covered by insurance. So they're cash pay, higher dollar tests, but they give us a different lens in terms of what else might be going on from the ecosystem standpoint.
Sure. And do you recommend often any sort of genetic style tests as well, like MTHFR and those sorts of things?
So that's really interesting. So I do also offer the Dutch test. Okay. And so that looks at your waste metabolites for hormones, specifically in women. I haven't done the full training for men, but I have definitely gone over quite a few Dutch tests with my patients. But there's a component in there that does look at some genetics in terms of detoxification. But in terms of looking at that, what I've done through the years is something a lot of patients have already invested in, and it's the 23andMe, but putting it into a different algorithm. So it's not just the data that tells you, and I think it's a valuable test, to be honest, but the data that tells you like, oh, your urine's going to smell like asparagus. If that's your genetics, like, when you eat asparagus, if that's
yeah,
like, and what is that going to help me prevent disease? Not really. But there are other programs you could put in the raw data. And so I've probably done, I don't know, maybe 20 consults in this arena where if a patient's comfortable, they share their raw data with me and I upload it into this other program. And then it looks at the MTHFR status. It looks at how do they metabolize choline, which is really important for brain health and development. It looks, I mean, I'm just naming a few examples of the expansion of this program. But it really looks more specifically at the SNPs. And research is always coming out. So that's kind of the blessing, I think, and the curse in terms of that specific genetic test, and why a lot of people don't want to get it is because their information's kind of in that database.
Sure.
But as soon as they add more research to that database, you learn more about your own genome.
Right. So it's a double-edged sword.
Yeah. So I haven't, other than that, that's kind of where I end.
Totally.
But a lot of patients are like, oh, I have my raw data from 4 years ago. Not a lot's changed in their, data.
So, and do you do any work with animals?
No, other than having a hobby farm. So I have a pig named Kevin Bacon.
Aww.
And 2 goats, 3 chickens now, and then 2 dogs.
Nice.
So no, I don't usually work with animals.
Sure. But it would be interesting to collaborate.
It would.
I think this arena exists for people. Why couldn't we empower pet parents to do some types of genetic testing, get information on how best to feed and supplement their pets too, right?
Exactly, because that's what I do as a customized nutrition. There is no recommendation. There's no one size fits all.
Right.
And so I think the more information we have on humans or more data we have on animals, the better we can support them.
I think that'd be interesting to look at.
For sure.
And so it sounds like your strength is essentially bridging that gap between the sort of Western insurance-based medical paradigm and then basic nutrition, and then putting those pieces together and then customizing diet and supplements for people.
Yes, because that is within my scope of practice. So that's where like the trickle down is making recommendations if a more, let's say, anti-Western medicine patient is thinking they're going to talk to me and get validation to not get the workup. Often I'm going to encourage the colonoscopy or the EGD test or anything that we do need to clinically look at. Right. But often I find that advice coming from someone who might seem more functionally inclined is understood or lands a little bit different. So it's been really, really comforting for me, not just working virtually, but I'm not going to just say, oh, let's just not look into that. I know a great probiotic when they've had chronic loose stools for 10 years. I'm not, I'm use that knowledge and background and kind of medical office understanding and the body the understanding of the body to encourage patients to get, hands-on medical testing and workup when warranted.
Sure.
But what is in my practice is, hey, my colonoscopy said it was fine or there was a polyp and it was removed, but I'm still having symptoms. Now what?
Yeah.
And I get to say, let's get deep. Let's look at your microbiome. Let's change your diet 90 degrees, 180. Let's really jump in.
Yeah. That's great. So what would you say the most common nutrient deficiency is that you tend to see in people? So
measured, with measurable is vitamin D. I see that all the time.
Super common.
Probably 8 out of 10 patients.
Yeah.
Unmeasured, meaning diet recall based. Many patients are not eating enough magnesium-rich foods or potassium. And both of those are not reliable in a blood test.
Right. Because the tissues will hold on to, they'll hold on to the, So you can't,
You can't use those for a great, my magnesium's great, so I don't need to eat beans or other high magnesium foods. So I tend to see those very commonly. And then calcium also. So there's a theme here, minerals and electrolytes. Calcium is really challenging. I'm sure you deal with this in terms of animals, but the sources are very specific. And then through elimination diets, often my clients reduce or completely omit dairy products, which is really helpful for a lot of conditions, but it's a great source of calcium. So it places a lot of pressure on needing to eat wild fatty fish with bones, on eating nuts or seeds, especially seeds are pretty big powerhouses, beans, but even like greens aren't as good of sources of calcium as we want them to be. They're not very high.
Sure. Can you get, how much calcium is in bone broth?
It depends.
Is it a significant amount or?
I haven't.
It really just depends on probably.
I would say like a lot of the labels I've seen, because when I make it, it's, with like cow bones that I've cut, or I haven't cut them off, but they've been, cut off by the butcher. And so I'd like to think mine's higher than like a package, but who really knows? But I think they're around 10 or 15% of that daily value.
So
but
minimal.
that daily value is kind of based on 2,000 calories. It's not really, it's a big variation in terms of what does a woman in menopause need versus a man versus a 5-year-old. So bone broth is one of my go-tos for nutrition, and there's a lot of convenient products now too if you don't get bones from the butcher. But in general, I think we have to look a lot at different fatty fish.
And supplements?
Supplements can be a little tricky. I think our body absorbs best from food.
Sure.
Calcium also in a supplement form can compete with other minerals.
Especially if it's straight calcium and not a whole food mineral.
Exactly. Mm-hmm.
Yeah. What about things like bone meal, crushed eggshell, seaweed calcium? Are those?
I love using sea vegetables for sure, but I don't tend to use the other products in humans like we do in animals. And I know I give my my chickens crushed oyster shells and those kind of things. And I don't cry if they eat one of the shells for them to get more calcium too. But in general, for my dairy-free folks, I actually recommend looking at the milks that they are drinking, like your almond milk or your coconut milk, and seeing if it is fortified. That is an area, I think, especially for women who have been dairy-free or low dairy for like decades. It is important to get in either that fortified if you're not a big sardine eater.
Sure.
I know you guys talked about sardines before, and I'm a big fan of sardines.
Are you?
And they're a huge source of calcium too.
Okay. So how many sardines would I need to eat to get
in a day?
Enough calcium for my needs, would you say, on average? Like for,
okay,
a
so
middle-aged woman.
For a whole day's worth of calcium, you probably need a can of sardines.
Whoa.
2 tablespoons of a seed, so like hemp seeds, chia seeds, sunflower seeds, 2 cups of broccoli.
Is this in
a day?
And all these things?
This is hard to do. This is why.
Wow.
This is why when I talk to patients and I hear I don't eat fish or I don't eat beans and I don't eat nuts or seeds
Or dairy.
And so we're
Where are
like,
you getting your calcium? Do you gnaw on bones?
they might need to. So that's a big, for 2 months, whatever, the body will figure it out and adapt. But for years or decades, that might be a patient who would benefit from a supplement. Or if you're thinking like, oh, I don't really like sardines, and then we might think about lower level supplementation, meaning not the max dose, not this really high amount of calcium just dropped in your body.
Sure.
It's absorbed better in smaller doses.
Sure. Interesting. And what about magnesium? Do you tend to use supplements for that, or do you tend to?
I do, but it's often more for other conditions. So again, if this patient fits into this category where they're not eating beans, greens, nuts, or seeds regularly, which can be quite a few people out of preference or belief or gut health, those are the highest forms of magnesium, and chocolate too, but regularly. So that means daily we need to be having like 2 or 3 of those choices. So I do often recommend magnesium to patients, but it's usually when coupled with another benefit. So magnesium is great for mood, can be a nice downer. It's a relaxant.
Calming.
Yes.
And we do see a lot of anxiety, I'm
Mm-hmm.
sure. We see a lot of anxiety issues with pets. I'm sure you see a lot of anxiety with people.
Yes.
How much of that do you think is magnesium related?
I think a lot of it is because these foods, again, are, when we're looking at magnesium-rich foods or even calcium-rich foods, they're more intentional foods, I think. Like, how many seeds does the standard American really have in their home? Or nuts? Like those are kind of specific nutrient dense foods. They're not really in our culture. They're not in school lunches. You know, they're not like foundational to our, you know, nutritional pyramid, I guess, culturally.
Right.
So I think people have to go out of their way to add in those foods.
Sure.
And then beans are just kind of, you either eat them or you don't. They bother your gut, or you you avoid them, or you love them and you eat them more frequently.
And that's going to be a genetic difference amongst individuals,
or microbiome.
Right? Sure.
Yeah.
Sure.
A lot of times it's what species do you have in your microbiome to help you break down the fiber from the legumes.
Got it. With regard to the seeds and nuts, I don't know. I mean, I learned some of my nutrition knowledge is from the Weston Price Foundation and Nourishing Traditions and Sally Fallon, and they're really they really stress the importance of soaking and sprouting the grains and nuts to eliminate the anti-nutrients and
phytates.
Do you have your patients do that, or do you feel like it's still beneficial, just even if they're, you know, just buying dried chia seeds and throwing them in their smoothie, or how do you have them prepare?
You know, I love Nourishing Traditions. I love the approach, and I love
nutrient dense.
Yes, I love teaching
ancestral style diet.
Yes,
right.
But not every patient shows up either ready to do that or willing or wanting to jump in, and I feel like those concepts are very true in certain cases. However, I also feel like if it's not broken, like if I have a patient who seems like their nutrients are pretty great, they're doing all right, maybe a little low in magnesium or calcium sources, we'll talk about foods. And if they feel great, do they need to soak and sprout and have that maintenance in addition to normal life?
Right. Just get it in. Get it in.
And let's see how you do.
Right.
And so if they feel, I felt kind of bloated when I did that. Okay, let's take a step back. Okay. But I don't usually across the board teach that because
it's too high maintenance.
It's a barrier. It's too high maintenance. And so it might be ideal, but is it realistic? So I'm kind of always going back and forth in my sessions of educating. There is this maybe ideal,
right?
But if it's stressful or unrealistic for you, it's not ideal.
Right.
So some people do both. Some patients say, I feel pretty normal and I have some time, so I'm going to soak my cashews. Or they say, I feel great, I love it, I'm just gonna keep going with it. Then get your magnesium in that way. Okay.
Are there certain nuts that are more inflammatory? Nuts or seeds that are more inflammatory, or does that also just vary?
In general, peanuts tend to have more toxins.
More the mold toxins?
Alpha toxins. And I think of them like in this like sleeping bag sauna, right? Like a peanut grows in the earth and then it's grown in their cute little shell. And so it's just more prone to keeping moisture inside. And then what do we do with peanuts or with even other things that are more prone?
We put seed oils on them.
Well, that's one of them. But also, what do? We lay them out to dry, we think, but then other stuff lands on them. And then we blend them all together. So then that, let's say, one little peanut in your group was contaminated, it all just kind of spreads.
Okay. And that can happen with coffee too.
Coffee, tea,
that's a big
grains. One. I mean, that's how a lot of things are harvested, laid flat to dry, we hope, and then put back together. So there's the other, thought of, are they not dry enough when they're stored and then they're kind of moisture rich? Is that a part of it? But back to nuts, I'd say peanuts tends to be the most studied. So I think that's where we're getting more like, it has kind of a bad rap.
Right.
But again, does that mean we swear off peanuts forever? No, but can we add in these other nuts and seeds to kind of augment our peanut dependence if we have that, or our peanut preference?
Sure.
Yeah, so I'd say peanuts tend to be more inflammatory for patients, but it might not be the protein in it. It might be more of the mold toxin present.
Okay.
Mm-hmm.
So ideally, though, when you are utilizing the seeds or nuts category, try to get them organic raw.
Yes.
And then keep them in the freezer.
Or fridge.
Store them in the fridge or freezer. And then, that's going to be the best way to... to consume them.
Yep. And then you can roast them if you want. I think roasting's fine. It's just how are you going about it?
Yeah.
At home, lower heat's better.
Yeah.
And then how do you feel afterwards? And there are products out there that you can get. I love shopping at Costco. And if you feel okay eating, roasted, toasted pistachios from Costco, they're a great snack. Yeah. And so my clients who I'm doing more soaking and sprouting with or being a lot more cautious with mold toxin are my sensitive patients. And so they're showing many other symptoms.
Sure.
But as a rule that I'll educate, but not, enforce, let's do this with you just because.
Yeah. Yeah.
So, and I think those, the nourishing tradition principles are so great.
So great.
But we're also working parents, like there's all these other things we're managing. And so I love that they're trying to kind of bring back, I think of it like the olden days, like trying to figure out the modern day versus with some older day practices. And we were quite better off then.
Right. This is not the world we live in.
No. Yeah. So
we
trying
don't
to
have
figure
6
out
hours to be prepping our meals.
Yeah. Or live like on a compound where you have your sister and your mom and your other folks who can share some of the load too. Sure. That'd be nice.
Yeah, totally. Well, and then circling back to the vitamin D deficiencies, certainly the low vitamin D I know can cause low mood, weakened immunity, more infections, increased risk of cancer, hormone imbalances, the whole gamut. That's kind of like the master hormone. So do you recommend vitamin D supplementation, or are you trying to source that from foods as well? Or the sun?
Both, all of the above. It's very challenging for patients to get enough vitamin D in from foods unless we're eating a lot of fatty fish and the skin, which is an acquired taste, or organs,
liver.
Mm-hmm. And so I often do a combination. There's a lot of skin's kind of this other like area that I haven't dove into really deep in terms of the controversy with sunscreen and those kind of things. But in general, we do benefit from getting out in the sun. But this time of year where we live, or north of Santa Cruz, that longitude line, we aren't making enough unless we're outside with a lot of exposed skin, and just your face and hands is not enough.
Right.
And to my clients who are more concerned about the sun, I just recommend getting out in the hours before 10 and after 4, especially in the summer.
Sure. And I know that animals don't synthesize vitamin D from the sun at all. So they have to get it 100% from the diet.
I didn't know that.
And we do vitamin D testing on pets, and they're commonly low as well. And there's suboptimal and optimal. And then there's probably, levels of that when you're trying to treat cancer and chronic disease that you really want to get them to a really prime optimal state. And that can be tricky, and it's a lot to ask a pet owner to be testing vitamin D levels on top of all the other things they're doing for their animals. So I tend to recommend cod liver oil as a food. I like to, like you, use a whole food based products for the supplements as much as possible. So cod liver, what do you think about cod liver oil? I mean, I love it. Certainly doesn't taste good, but
I use it all the time. I just started recommending in a couple patients a gummy, and I've been so against gummies, but for the longest time I've done liquid.
Make a cod liver oil gummy?
It's fish oil. It's not specific cod liver, but it's very high in EPA and DHA. And for the longest there had not been. This is for kids primarily. Okay. But
is that the Nordic Naturals?
It is, the orange one. Okay. But for the longest time, there just wasn't a high enough gummy that I... Yep, a high enough EPA and DHA in it. Yeah. Which is a subset. But those are the fats primarily in cod liver oil. But I had used a liquid for so long for kids. But getting it in, oil and liquid doesn't mix. So putting in a little bit of juice, it's just like a shot of lemony fish on top of your apple juice. Yeah. So a lot of my patients now are enjoying that. The gummy to get in a decent amount of the EPA and DHA. Okay. But yeah, so I love using that for kids, adults. And then also, again, I do a lot of vitamin D supplementation that's very evidence-based. It's not like
Sure.
mega doses or, and often with testing.
Sure. You have to be careful. And then you're combining it with K2.
Yep.
And what is the typical dosage that you'll use for people on D?
So for adults, it really depends on where their levels are at.
Okay.
And so if patients are under 30, so if their levels are under 30, even if they're 29, I love physicians so much, but most insurance-based physicians are going to be like, you're okay. They won't say anything if you're 29. I catch it all the time. And it's 1 point less than the lab. But again, 30, I'm sure it's going to get revised soon. So 50 is a little more optimal, like you were talking about for different disease states. I prefer someone closer to 50.
Yeah.
If they're 40, I'm not usually going to supplement unless it's like the beginning of winter. But this time of year, if a patient's, let's say 20, it's probably come down all through the winter. I often do 10,000 IUs for 2 months at least.
Okay.
Then we drop down to 5,000 or we recheck. Okay. And so that process is like very unlikely to cause high levels of vitamin D, but it's enough to bring them up quick enough, safe enough, and then it is kind of back on the patient since I'm not able to retest.
Sure.
We're bringing it back down to a normal high level. But a lot of patients are taking 1,000 or 2,000 thinking that they're supplementing enough, and it's usually not enough. Okay. So just ask. We have to ask to get our levels rechecked.
Okay. But on average, 5,000 is a good maintenance dose, especially if you're not in the sun a lot.
Or if you've ever been low.
Right.
Because that also implies our dietary sources are probably low, our essential fats might be low. There's usually a deeper absorption challenge going on, and I often see low D with low omega-3s. Okay. So those kind of go hand in hand.
So if you're also taking omega-3, a good quality omega-3, you probably don't need as much D.
Possibly.
Possibly. Okay. Okay. What do you think the biggest culprit of driver of inflammation in your patients is?
I think it's stress.
Okay.
If we're to get really global, I think it's stress.
Okay.
But what is causing that stress, right? Usually stress is multifactorial.
Right.
We can have physical stress if we don't feel well.
Right.
Lifestyle stress.
Chronic pain.
Chronic pain causes a lot of stress.
Yeah.
Grief, emotional. I mean, there's a lot of stress.
Right.
And everyone's trying to figure out how to live with it, really, right? Yeah. And not have it impact our body. Yeah. But inflammation, that was your question, right?
Yeah. What what's the biggest driver of inflammation that you see?
Yeah, so I think it's stress. And so then we can, break it down a little further. Dietary stress is one thing. Even exercise stress is another thing, or undernourishment. I see a lot of undernourishment in my patients who are trying to lose weight. And
not getting enough calories or not getting enough nutrient-dense foods.
Yep.
Yeah.
Or going too low in calories because the app told them to.
Yeah.
Or we're getting applauded by another app membership for cutting down our calories 500 a day, thinking we're going to be feeling great and losing weight, and it's not enough for our life.
Sure. And then they get inflamed and then they can't lose weight.
Yeah. So I see that a lot.
Interesting.
Yeah.
Okay.
Where there's that.
And of course, sugar. I'm sure sugar is a big one.
Sugar's a big one. Caffeine's a big one.
Loves the sugar.
Yeah, but if you're not, I'm like not in this world of knowing like what's in Starbucks drinks or like Dutch Brothers drinks or anything, and I'll see these, posts online. I'm like, people are drinking this. Like I'm on another planet sometimes.
Yeah.
With my decaf coffee.
I don't go there either. But the Frappuccino thing is like a weird to me. Yeah.
It's a whole nother world that I don't always think about. And so when I do my diet recalls on a one-on-one, I say, do you have any other foods that you get or drink or order regularly? And someone will say something and I'll like put it into the nutrient analyzer, and I think that's sugar. And caffeine. And so I think there's just these other things our bodies weren't meant to handle, either one, like sugar, or two together, sugar and caffeine, that are just pro-inflammatory.
So you caffeine at all? Or is there a safe amount of caffeine?
I think there's a safe amount depending on genetics, but that's something I've learned in my history that I need to take it easier on.
And then how it's stacking up with all the other stressors, right?
Yes,
right.
Definitely. And it can get in the way of how you detoxify. Can kind of block some of that phase 2 detox.
I do think that having pets is a de-stressor. So
For sure.
It's
for
nice
sure.
for people who have they have a closer relationship with their animal. I know for me, like the emotional support animals, concept.
It's huge.
Like they're taking all of our stress. They're taking it on. But they
are
are also helping us.
But they want to.
And it's fine.
They're just looking at you like, what can I do? What can I do for you?
So people should get dogs or cats or
I
horses,
agree.
right? To help with their stress. Don't you think?
I agree. And I have a herding breed, like, would you call yours a herding breed?
Herding mix, yeah.
A herding mix, there we go. And so what that also affords is time outside for me.
Yeah.
Because I get to go walk with my dog because he actually needs it. And I do too, but it's
forces you.
A must. And I don't really need to be forced, but it's another reason, again, to get outside and to enjoy that connection and nature time.
And exercise.
Oh, yeah.
And then, of course, you say exercise can be a form of stress if you overdo. So there's that balance between how much exercise, and that's probably different for everyone.
It is.
Right?
It is.
I know I'm not like naturally super athletic, and I do, of course, exercise, but if I'm not at the CrossFit box, like that will kill me.
But that can be a really good thing because I work with a lot of women and some of them are feeling like they're dying trying to do it and it's not right for their adrenals or their stress level when they just need to sleep in and go for like an hour walk later in the day with their animal versus wake up early and
go to Orange Theory.
I was just going to say it. I love it. I am like that like bring it on. But it's a little too intense for patients who are working on other health issues for sure. And it adds to some stress. So if we're able to fully rest and relax kind of the even amount of time, I think we can balance it out. But if we're hitting the ground, Orange Theory, then we're doing our 9 to 5, then we're full on parenting mode, and then we're staying up late because our house has to be perfect and all that, then it's just too much.
Right.
It's too much.
And that chronic stress specifically is going, I'm assuming, you can correct me, but it's going to be depleting specific nutrients like your B vitamins and your magnesium and all the things that we talked about.
100%, because you're going to be driving, and even vitamin C, like cortisol is a gobbler of vitamin C. And so the higher, you have higher nutrient needs. And then if you're, for some reason, watching your calories, you might not be getting in enough of those nutrients.
Are you a Linus Pauling believer? Do you believe in taking vitamin C supplements and, high doses in certain circumstances?
In certain circumstances, yes. And I think, again, with I do love vitamin C, but it's absorbed better in smaller doses. And so, again, is that realistic? I think it is.
Are you going to sit at your desk and pop a vitamin C every hour, right?
Yeah. And I have so many patients who've taken Emergency for years, and then I show them the packet, and I'm like, there's 2 teaspoons of sugar in there. They're like,
and you can't absorb all this in one setting.
Yeah. And so, but it tastes good. And so it's not I don't want to, slam a bunch of brands either. There's other options out there. But yes, so I do like vitamin C, but we can get quite a bit from food. And I think if we focus on just supplements, then we're going to have just powders and drops and drips and capsules instead of eating in the season and, eating kiwis in the winter and cuties in the winter and pomegranates. There's a lot of vitamin C there for humans.
Okay, great. What is your opinion on eggs as a superfood? I know eggs are really touted as a superfood with, the choline and the fats. But then, I know that there's a lot of people who are sensitive, like it can be a common food allergy or sensitivity as well. So how do you reconcile that?
So for the general public, I love eggs. Happy farm fresh eggs, ideally, because they're eating, grass and worms and grubs, and they're omnivores, and so they're just like eating all the good stuff. Yes, no. So if we can,
soy corn fed eggs.
No, if we can, from your neighbor's chickens is ideal.
Yeah.
And then same with cholesterol. Like I have, I'm still getting patients who are saying, "Oh, my cholesterol was high. I need to limit eggs," and so I'm educating quite a bit on that in terms of how the body works, and most people do not need to limit quality sources of cholesterol, like from eggs. So I hope you heard that one. Take that one home. But in terms of gut sensitivity, if a client is already working through some symptoms, it is one of my main proteins to pull out or remove with or without food testing. So I often give my patients an option. Hey, let's try this first. An elimination diet possibly where we remove, depending on their diet and their symptoms, let's say egg and dairy. Let's do this for 4 to 8 weeks. Let's check back in and look at your symptoms. With testing, sometimes that can really guide us. I can say, oh, wow, you have this IgG immune response. You're really leaky to egg. You're eating it every single day. We still probably need to remove egg for a period of time. The food sensitivity test also looks at other forms of immune response like IgE and a complement protein, as well as this like developing allergy to egg or to 88 or 87 other foods. So it's pretty interesting to see those results, but also hear patients' stories with egg and how they feel when they eat eggs.
Yeah, yeah.
And
it probably depends on how those eggs were raised, right?
It can, and what else the patient is working on. Because I have, they have either IBS symptoms where it's like kind of hit or miss. So sometimes eggs bother them, sometimes they don't. Maybe it's how they're cooked, because the higher the temperature, like a baked egg tends to be better tolerated than a scrambled egg or a over easy egg. The protein hasn't been denatured as much as when it's cooked in an oven at 350 for 20 or 30 minutes. Right. But the best thing about eggs is they're convenient and they cook up pretty quick. So most people are cooking them on the stovetop. So in general, I think eggs are amazing. I think the quality counts and is very important. And if someone's eating the cheapest or the sunny side or whatever, run-of-the-mill egg, I do recommend eating eggs less, only because then you can afford the quality. So you just shift it around in that aspect. Okay. And then in the other cases where we're working on gut health, constipation, or acne, egg is one of my targets. I do see often contributing to those conditions.
Interesting. Mm-hmm. Interesting. With regard to the food sensitivity testing, can you discuss your favorite testing lab that you like? And do you know whether that lab is open? Do they do animal testing?
I don't even know if they do animal testing. That'd be interesting.
I imagine the proteins are all the same. The antibodies are the same too.
I would imagine too. Right? I don't even know. I would love to find out. Yeah. I use Precision Point Analytical because they have a home test. They have a DIY test. Cool. I used to use Infinite Labs. I still have an account with them. They're great. But they do lab either home phlebotomy with, a lab draw, or you go to a specific clinic, which is, half an hour away for a lot of my clients, and you need an appointment. It's this and that. So
not as user friendly.
No, I like the DIY because it's also good for pediatrics, which is probably a third of my patient population. Okay.
And with the gut sensitivity or the food sensitivity testing, I know that we do it some with our pets as well in our clinic. And I feel like it's a good starting point, but I think what we have to stress to the clients is that the gut is a dynamic environment, and just because your pet tests that it's reacting to these proteins right now doesn't mean that they have to be off those forever. Is that your
same language?
People?
Yes. Mm-hmm. And also another reason why I prefer to not do testing right at the beginning of working with patients. I just started doing testing on my own for probably 3 or 4 years ago. Before that, the other 12 years, I've figured it out without testing. So the testing provides...
You can get the same information with eliminating the foods.
Yes.
It's probably more accurate.
I think it's a little more intuitive. Yeah. The testing provides a roadmap, which is easier for me, I guess. But I also talk to patients like, what kind of receiver are you of information? Once we know, like if you have an IgE allergy to egg that's moderate, once we know that, we have to do something about it. Like my responsibility is to tell you, hey, you actually have a pretty serious immune response to this protein. Yeah. I do recommend you remove it for a long period of time, maybe 6 to 12 months. Okay. Depending on your conditions and what else you're managing, because it's obviously not causing anaphylaxis if you just did a sensitivity test, an allergy test, and found out that you're moderately allergic. Right. But it can still create
chronic inflammation. And then all that stacks together with all the other things.
And so we have to be ready for some of this information, especially from a food test, because I believe there's a responsibility to take action, and we want to be on board with it. We want to be ready for it in case it is some really healthy foods like eggs. Yeah. A lot of people respond to eggs.
Yeah. Okay. What about hormone health and how and the relationship with hormone health and the gut microbiome immunity?
Yeah, it's pretty interesting. This is an area where testing is very helpful, and especially with the Biome Effects stool test I do, because they look at a subset of species that is in charge of recycling estrogen. And so it tests, how is that system doing? How are your species looking for men and women? And it's eye-opening information. And I've done enough to try to predict, but I don't have a crystal ball. So when we have this test, it's like, wow, okay, we really need to work on hormone balance. We have to figure out what is lacking either in your diet that can help support a lot of these chemical reactions in your body, or further down with liver health, or further up with liver health or detoxification. In terms of the Dutch test, in the microbiome, they have a couple indicators on there of markers also of the organic acids that I see higher with bigger GI imbalances, but a lot of the basics come into play. So if someone's debating, if you were to come say, oh, I really want to do a hormone test, but $500 is quite a bit for a test. And I say, I hear you, I get it. And they ask, well, what are some of the common, interventions you guys do, or we do with the results? And so often there is a lifestyle component. So what is that? Is it working on sleep? Is it working on stress? Is it, again, maybe doing less intense workouts and still moving your body, but in a different way? So there's a lifestyle piece, or water filter, who knows what else, right? Just something kind of broad reaching. And then we talk about diet. So what kind of support can we give the diet in terms of different minerals, different fats, different boosters that can be more like phytoestrogens in the body. And then there might be the supplementation category, where we might need adrenal support, thyroid support, like glandulars. We might need, what else do I use? I use maca. I use creams. Sometimes I'll use creams or homeopathy, like
progesterone cream.
Non-prescription, right? So it's just like
plant-based.
So those are kind of our arena. So then some people are like, well, you kind of talked me out of doing the test. But again, those are kind of the how I treat patients with or without a test, is looking at those kind of three areas in terms of symptom management. And so the hormone piece, again, how does that relate to gut health, is often our hormones are out of balance, and they kind of shift, kind of like a sea urchin. And so if one hormone's kind of out of balance, it kind of moves the other ones out of balance. And then that can create more stress. And then our microbiome is the tuning fork in our body. So if it catches the drift, oh, your estrogen's too high or too low, your gut's going to be like, what is happening? It might have some additional symptoms. So
interesting.
It's all related.
Very interesting. Yeah. Super helpful. Can you talk a little bit about your opinion on incorporating grains in the diet? I know that, from just as an aside, in the pet industry, the traditional, like, big pharma based kibbles that have been around forever traditionally have utilized GMO Roundup heavy grains
Cheap
as their
fillers,
base, particularly wheat and corn. And probably in the last 10 to 20 years, pet owners are realizing, hey, if I remove these grain-based diets from my pet, I have less skin issues, less itching, less diarrhea, less whatever, all these health problems. And so the pet food industry responded by creating these grain-free kibbles. Well, what they did was they replaced the grains with legumes, because they need to have something starchy to bind in the protein into this little kernel that they cook at a high temperature and make it inflammatory. So when you feed that, now instead of feeding wheat and corn, you're feeding chickpeas, lentils, sweet potatoes, things like this. Well, it turns out those have anti-nutrients that block the taurine absorption from the meat, and then in a small subset of golden retrievers, or specifically genetically weakened, sensitive animals, they were getting dilated cardiomyopathy problems from taurine deficiency. So now all of a sudden we need the grains. We need grains. They need the corn and they need the wheat.
Wow.
This is the response. And that study is actually debunked. So it's kind of controversial, but I get a lot of clients saying, well, is it bad that I'm not feeding grains? Like, no, they don't. It's not that they need the grains. It's that they shouldn't be eating all these legumes, which have anti-nutrients, which could be affecting their taurine absorption. So that's a whole kind of aside. But I do find that, grains in general, it can be high in glyphosate. They can be inflammatory in the animals, and they contribute to excessive carbohydrate load, and then that creates metabolic problems and inflammation, and then down the line. So what's your take on incorporating grains in the human diets?
Yeah, I think it's kind of similar to what you described. So looking at infancy and when to introduce solid foods is a great example. And that's one of my favorite populations to work with. So all the excited parents, how do I feed my kids? It's like, oh, let's start this out fresh. It is not with fortified rice cereal. And so that is one thing not to do. It's very constipating. It's very sticky. It also doesn't have a lot of...
load.
It is. And it doesn't have a lot of calories to it compared to avocado or butter or liver or some of these other really nutrient-dense foods. So it is more of a just product of what some would say necessity, or the whole stream we're not swimming in right now. Right. And so again, I'm not saying all rice is horrible, but to start our children off, it's not the preferred food. It really depends on the patient. So most patients, I'm talking about limiting grains, having intentional grains. I would say 75% of my patients, I'm recommending a gluten-free diet with conscious grains, meaning either it says glyphosate free, which is on some products now. It's hopefully up and coming, so it's at least being tested for more often, which is pretty great. And then leaning more on whole foods carbohydrates. So some of the ones you listed, sweet potatoes, legumes, winter squashes, or gluten-free grains like rice, quinoa, milk. I recommend patients soak brown rice. And if someone really prefers brown rice, or they're just stuck on it, this is my thing, I definitely recommend soaking it in, a quart of water, or I use mason jars with some apple cider vinegar or lemon juice to just help with some of that. It does
soak it overnight?
Yes, but it's safer to move it to the fridge for foodborne illness reasons. But so soak it, move it to the fridge. But basically you're pulling off some of that arsenic, not a lot of heavy metals, but it does make it more digestible too. So it can help break down some of that, some of the anti-nutrients too. But I'd say at a minimum, rotate back and forth between brown and white, because wild is also another great form of rice.
And is that doesn't have the arsenic issues?
Not as much, and it has the phytochemicals that's missing in white rice. Because white rice is less in arsenic, but it doesn't have as much fiber.
Right.
So it's not as glycemically balanced.
Right.
So,
but if you take the white rice, cool it down, it will create, and then you eat it, it will create some resistant starch, which lowers the glycemic load.
Love it. I love resistant starch, and it can be done in many different ways. So you do have to reheat it though. So it's cook, cool, reheat. Okay. So if you're eating it fresh,
if you eat it cold, it's not the same.
You want to reheat it.
Really?
It's still resistant, but the heating is another process that helps change it. But if you've eaten leftover oatmeal, it's gummy, it's funky, or even mashed potatoes sometimes get a little gummy leftover. It's because you've created this resistant starch. So I think that is preferred. Okay. But again, in this world, not always realistic. But even cooking, cooling it for, let's say, even an hour or two, and then reheating it, it'll be more resistant than eating it fresh and hot. Okay. A lot of my clients will batch cook it and just freeze it and then thaw it. Any of their carbs, they can do that.
And that would be reasonable to do for the pets too. If you're making your own homemade pet food with some rice in it, then definitely try to cool it down first.
Yeah. And the benefit also, I just want to highlight, is that it doesn't make it have less carbohydrates. It changes the chemical structure to be more feeding and nourishing to our microbiome versus just woo, let's get carbs. I love carbs, but we don't want all of them to just be in an abundance in our digestive system. So it makes them more resistant, but also more like a prebiotic.
Okay.
So that's the whole goal, is to feed our good guys and not just be fodder for bad guys and blood sugar and all that.
Right.
Yeah. So it's
Very
better
good.
for digestion. So that is a topic in comparison to like soaking and sprouting nuts.
Mm-hmm.
The resistant starches is more of a like, oh, I think everyone would benefit from creating resistant starches in the home for your family.
It's more critical
across
than
the board.
dealing with the soaking of the...
I think so, because it just has it's easier to do too.
Yeah, easier, and there's some known scientifically based
Yes.
benefits, right?
Yes.
Interesting. Okay. And then the wheat issue in this country, of course, everyone knows like the wheat in Europe is easier because of the glyphosate load being lower. So I guess, there's ways you can incorporate glyphosate-free wheat in this country. You just have to source it correctly, and then you can probably handle some gluten, right? It's maybe not specifically the gluten. A lot of it's actually the glyphosate in the wheat, correct?
Yes. And the patient, some people are doing just fine being omnivorous.
Right.
But if we have more extensive GI issues, sensitivities, IBS, which a lot of my patients do, and a lot of IBS, most of IBS is just our ecosystem being imbalanced and not knowing what to call it.
Yeah.
But yeah, a lot of patients benefit from a lighter gluten load or a lighter glyphosate load.
Right.
And so,
Right.
yeah, that's one way to do it.
Do you work much with glyphosate and other toxin binders, detox supplements like fulvic and other things like that?
Yep. Most of my patients are on, I'd say, some form, whether it's like chlorella or like you mentioned, the humic fulvic. I like dietary cilantro is another really helpful binder.
Do you just do that in a tincture form or just fresh cilantro?
Eat as much as you can of cilantro, organic cilantro washed well.
Okay.
There's tinctures too, but most patients aren't going to do it. It's an essential oil. It's pretty strong.
Yeah.
And then also just clay.
Uh-huh.
Bentonite clay, zeolite. I mean, there's sky's the limit with binders. I think binders are very beneficial, especially when looking at parasite. I'm curious if are binders a thing with pets?
Yeah. I mean, I don't think it's well represented or, well talked about. But yeah, I mean, they're exposed to the same toxins and parasites that we are.
Well, and I think they would have more, they're more likely to be obviously eating things. Well, maybe not more likely, but again, like I watch my pig, scurry around in the dirt, and that's free binder right there.
Totally,
getting those minerals.
Why is my dog eating dirt? Probably because you're feeding it too much glyphosate.
Yes,
right?
They're binding.
Yeah, they're binding.
They have the free binder in my backyard. I have to order mine online.
Just go out in the backyard, dig up some dirt and
clean up. That's what I call humic and fulvic. It's like purified dirt, purified earth.
Yeah.
So those are very helpful for patients. I know,
especially in the modern world, right?
Yes. And when I hear just a cluster of symptoms, like I had a patient the other day, she's like, I don't need to drink alcohol very often, but I would like to have a glass or two once a month. They have a wine club, and I'm like, okay, she said that. And then she gets some vertigo, and then it's sensitive to smells, and, just a couple of this sensory kind of overload of her. I think she has a little abundance of, inability to detoxify, but an abundance of exposures. And so I said, okay, well, let's work on this long term. But in the meantime, if you're still going to have your glass of wine, let's add a binder with it.
Okay.
It doesn't negate a hangover. It doesn't make the alcohol less, toxin giving. But for her system, it's one thing that kind of overloads it.
Sure.
And she probably benefit from a binder daily for a while.
Sure.
And this time of year is a lot of seasonal threats in the spring.
Right.
Because it's not just pollen, it's everyone spraying.
Sure. All the
weeds coming up.
Yeah, absolutely. And the animals get it directly on their paws.
And their face.
Yeah. So, okay. Well, good to know. So I've been kind of playing with the idea of the concept of fasting with regard to pet health. I see a lot of clients coming in that are kind of just like free feeding. A bowl of kibble is always there, and the animals are going by and picking all day long, and they're constantly getting that insulin surge. And I certainly know that that's not a good idea. But then there's also people who feed like, twice a day, or there's some animals that don't want to eat in the mornings. And I think that these animals sometimes just have a natural inclination to fast sometimes. And I don't think that's necessarily a bad thing. It's probably a good thing. And I think that actually as veterinarians, we might look at suggesting that we fast our animals once, well, maybe not the herbivores, but the dogs and the cats. Why shouldn't we fast them or do some level of intermittent fasting? It's probably good for them. And we get set into this schedule, like we have to feed them at this time. Other than the guilt factor, I think that would be probably a good idea.
Well, and you mentioned the guilt factor. For me, it's more of an annoyance because my dog, like one
yeah.
of them will just
There's
do
the
spins and bark at me when I'm in the kitchen.
The cats are
yes. So they get used to that routine though, and that's from training, right? Or
yeah.
the expectation of this time of night I get a full belly.
Yeah.
But I'm with you in terms of adults or kids. From a nutrition perspective, we are not meant to graze all day.
Right.
Our digestive system really needs a break between meals. For adults, at least 3-4 hours between times of eating, if we can. If that's kind of a standard recommendation. But in terms of a more prolonged fast, many patients benefit from a 12-hour fast, and anything really other than black coffee, tea, or water is considered eating or breaking that fast. Now, depending on a patient's age, there's different fasting benefits. And the reason is because, let's say women in their more fertile years are premenopausal. There's a very heavy nutrient need, a very heavy mineral need. We talked about minerals earlier. And if we cut down our eating window too tight, we might only be able to get in 2 meals. So you and I talked about how tricky it was to fit in certain nutrients and minerals into maybe 3 meals a day. Then we cut a meal out and already you're like, well, where am I supposed to put the sardines and the nuts and the beans when we're only eating in a 6 or an 8 hour window? So there's a couple more specifics in terms of fasting safely in the perimenopause years compared to postmenopause. Postmenopause, women are a little more like men hormonally. They're not having the cycles. They're not having the ups and downs and the as high of demand on their detoxification pathways from a hormonal perspective. So fasting does really benefit postmenopausal women and men really at any time. Men can just kind of fast as long as they're getting their needs in, regardless of their like fertility space. But postmenopausal women, again, I like to play around with a 12-hour as a minimum fast, and then a couple days a week going maybe 14 hours, and then maybe 1 day a week getting into that 15 to 17 hour fast. And the whole idea is more of an intermittent fast,
Sure.
where we aren't doing the same thing over and over and over again. And I think that's what you're saying for animals.
Right.
Is
maybe feed them at a different time of day, or only feed them 1 meal some days, or feed them a lighter meal some days, or totally do a broth fast once in a while. That wouldn't hurt them. Or if they're sick, especially, definitely, rather than shoving chicken and rice down, which is probably pretty inflammatory for a lot of animals, maybe just give them some bone broth for a day if they've been having vomiting or diarrhea.
Yeah, give their gut a break, and it gives it a chance to prioritize the rest and not working on food or digestion, because that uses energy too. And when there's stuff there, it's not as restorative.
Yeah.
So taking a break for fasting or for illness for humans is another good idea, especially for GI bugs. For kids, it's a little bit trickier. They start asking for food. I do like to fast my kids, except for other sips of water, just small sips of water, at least 8 hours after any type of like vomiting, anything like that.
Okay.
And it tends to resolve faster because a lot of times it's just going to come out anyway. But
yeah. Do you use binders too with that?
it depends if they're able to, how much they're able to keep down. A lot of binders work better with a little more fluid on board, and that's kind of tricky.
Okay.
But that's another opportunity to incorporate binders, or if you're around someone who's doing that, you might want to increase your fluids and take a binder. It might help you out a little bit and start and fast.
Yeah.
And then in terms of how to do that, we want to do it safely. We don't necessarily want to just go on a 3-day water fast in the middle of tax season if you're an accountant.
Sure.
We want to be intentional with our limitations, especially if you're hearing this as advice. This isn't really advice specifically for you. This is general advice. So if you're thinking, oh, I never fast 12 hours, maybe try to get up to 12 hours.
Right.
If the 15 to 17 sounds crazy, please don't just jump up to that. We want to take into account our activity level, our specific nutrition needs. If we're on medications, if we have blood sugar issues, fasting can be really helpful to improve insulin sensitivity and leptin resistance, but you need additional support. You can't just navigate it on your own. You could have lows of blood sugar, you could have a lot of stress in your body that's counterintuitive or counterproductive, excuse me.
Okay.
But yeah, I'm a fan of fasting when it's intentional and you feel comfortable. We talked about this before about it. Maybe if you do a longer fast, having it be more of a self-care day.
Sure, where you can lay in the sun and relax or go get a massage or...
Yep, drink lots of fluids and lots of herbal tea and water.
Yeah. No, I think it's something that is not really talked about much in the veterinary space, but it's something to really consider for, to be intentional about the timing of the feeding of particularly dogs and cats, not herbivores, right? Horses and cows need to eat all day long. But the omnivores and the carnivores certainly evolved with periods of fasting, and now we're changing that biology, and then that changes the microbiome, and it's not natural.
It's not. And same for us. We live in comfort and we live in plenty, and I like that about my life. But from a health perspective, our body needs periods of stress to kind of combat that and respond and stay strong and metabolically flexible.
Sure.
And if it's always being nourished, if it's grazing all the time, it gets used to that. It gets comfortable. It gets kind of inflamed. It's not being utilized and evolving in the more appropriate way. It's kind of de-evolving.
Right.
So it makes sense for humans or animals. And I talk about my chickens a lot for with my clients in fasting, because if I have a chicken who's hurt, it won't really want to eat much for a while, and it drinks water, but it just kind of hunkers down and it rests for a day or two and it gets better.
Yeah.
I have a question for you about bone broth for animals.
Mm-hmm.
I had not ever really thought about that. So is it something you put in with other mixtures of foods, or is it like in a bowl, just like you would for water?
Well, you can do both. If you're trying to intentionally fast for, say, a GI upset, then you could offer it next, offer a bowl of bone broth next and plain water.
Yeah.
I wouldn't replace the plain, I wouldn't take away the plain water offering, but yeah, you can use it. But I have a lot of clients that use it as an additive to, like if they're using a dry kibble base, they'll moisten it with bone broth, or they'll add it to some other foods that they're feeding. And that can be a great foundation, a very inexpensive superfood to have in the house. Just don't add onions and you're good to go. Okay. I mean, if you're making it yourself, don't add onions to it. There's commercially available pet approved bone broths out there too. But it's so inexpensive and easy to make that a lot of people make it themselves. Yeah.
Well, I have a bunch of cubes in I have the silicone ice cube tray, and so whenever I have extra, I'll just freeze them in there. And so even
so, pop one of those ice cubes into your dog food bowl.
Okay.
Yeah.
Awesome.
Yeah.
Love it.
Yeah.
I don't know why I hadn't thought about that one before, because I have that for us, but just share it with everyone.
Absolutely. Yeah. Great. Can you tell me sort of what is if you have to pick, what's the lowest hanging fruit essentially for your patients that if you could say one thing that's going to help the most, out of the one change that you could make for the majority of your patients, what would that one thing be?
It would probably be to increase dietary variety.
Okay.
And mostly from plants. And I know we talked about some nuances with plants like nuts and rice even, and grains today. But in terms of variety, we are often likely to see less issue if we have a wide variety in our diet. If you're having rice 6 nights a week versus 1 night a week, and it's a rice that is contaminated, let's say, that's a bigger issue if you're having it so frequently. Right. But if we have this built-in variety, it's insurance for you. Whether it's from, glyphosate or arsenic or any of these other additives, if we're rotating through a non-grain dinner one night, or we're having cauliflower for cauliflower rice another night, or we're having winter squash another night, or sweet potatoes. We're rotating through all these different plants. And plants offer so many different phytochemicals. It's not just the fiber in them that is beautiful, it's the colors. The colors have nutrients in them that are anti-inflammatory. So again, looking at your diet, if you were to give me your food recall and diet diary, I would look for, first of all, she's getting enough protein, she's getting enough calcium based on what we were talking about, and maybe magnesium sources, but also looking for a variety of plants and colors, because many patients have their favorites. What is always in your cart at the grocery store? Mixed greens, oranges, bananas, cucumbers, and broccoli. Okay, well, that was a lot of green, right? What about orange? What else are we getting from the purple group? What else are we getting to bring in this whole rainbow into our diet? Because that is really the foundation of an anti-inflammatory diet, is the plant variety from colors. And then the topic we already talked about was our essential fats today.
Sure.
So the low-hanging fruit could be fruit, but a
Literally.
variety.
Literally.
Yes. So variety in fruit, variety in herbs and spices. Those also count as plants.
Okay.
And herbal teas.
And there's no reason we can't incorporate most of those into our dog and cat diets. Well, cats are a little trickier because they are obligate carnivores, but they can tolerate a little bit of vegetables. But certainly dogs are omnivores, and they can eat pretty much everything in the vegetable and fruit categories except for raisins, grapes, and onions.
Great.
So there's no reason why you couldn't, if you're making steamed carrots or broccoli or chamomile tea or all these things, there's no reason why you couldn't supplement your dog's diet with that to give them some variety. And I do also counsel my clients on feeding variety because of microbiome diversity, because of not trying to create a food sensitivity by overfeeding proteins, right? That's a common misconception that, you should stick with this one kibble and never change it. I think that's really bad advice. I think feeding variety, the timing of the feed is, changing that up is probably helpful.
Okay.
And getting different proteins and vegetables in the diet and fruits too is great.
I love that advice for animals too, because I definitely talk about plant variety and colors the most, but when we look at the microbiome or leaky gut, we really do want to rotate different proteins. And coming back to that topic with eggs that we talked about earlier, I end up seeing more sensitivities in my patients who are eating eggs every single day, over and over and over again. And eggs are great, but there's only so much our body can handle sometimes, and it needs a break. So again, there's more insurance and variety and more benefit in broadening our preferences in ways that make sense for us. So it might look like fresh herbs on the side, or mixed into soup, or again, I say herbal teas a lot because it's an easy way for all ages to get in some anti-inflammatory benefits without actually chewing a food. So I love the idea of giving that to pets too. I think that's awesome.
Yeah, why not? Well, thank you, Chelsea, for joining us today. And will you just let our listeners know how they can reach you if they'd like to potentially work with you?
Yes, that would be great. I've loved being here, and I've learned a lot too from you. So I have a virtual practice, so I'm available, usually normal business hours, but I can see patients all over. A lot of what we do is coaching in more medical nutrition therapy settings. It's helpful to work with a physician or a nurse practitioner also that I can connect with. But you can go to my website. It's nutritionwithcb.com, all spelled out, and those are my initials. And I'm also on Instagram with the same Nutrition with CB, and Facebook also.
Great. Thank you so much.
Thanks for having me.